Like the groundhog allegedly saw his shadow, so is he a liar or didn't see a shadow, right? Early spring. That's what we were
Right.
told. Punxsutawney Phil, he's a liar, is what I've determined.
Well, I
I
mean,
can't figure it out.
we've
Spring
had
did not
some
come
warm
early.
days, but
Liar.
more cold than warm lately, it feels like. But
Moral of the story is never trust a groundhog.
there you go.
This is On Call.
Wow, this would be really cool to just wear scrubs all the time. Then you don't have to think about what you're going to wear to work.
That's awesome.
We're here to answer your questions.
We can sit down and discuss all. Wait, I gotta go. I'm on call.
Wait, you're on call? I thought I was on call. Hey, everybody. Welcome back to another episode of On Call with April and Alicia. I'm Alicia,
I'm April.
and we're excited to have you guys back to continue our conversation. Last episode, we talked a little bit about important conversations and difficult conversations, and we really thought it would be a good idea to continue this episode with something similar, maybe along the lines of when things go wrong, but we'll get into that shortly. Just a little brief check-in. April, how are you doing?
I'm good. How are you?
Hi. It's been a busy week. It's been a bit of a hectic, crazy week, but I mean, all in all, can't complain.
Yeah, same here. It's one of those weeks where I feel like look at my schedule and it's like back-to-back meetings like all day long, and
Yeah.
I don't know why why that was like that. Maybe it's because
I
I'm going on vacation next week, been jamming everything in, but
Nice,
it's
nice. I
picking
think
up.
I feel like it's yeah, like I understand what you mean when you have those really busy weeks and you're like, my gosh, like I can't wait till the end of the week. And then the end of the week comes and I actually already feel dread for Monday because I
I
know
know.
maybe I didn't like finish all my stuff yet. And I'm like, oh my gosh, like maybe just one more day in the week so I can actually enjoy the weekend and not be ruminating about all the things that are sitting and waiting for me Monday morning.
I know. I actually like an hour ago looked at my calendar for Monday and I was like, do I have time to like get this to-do list done on Monday or not? Or do I need to
Probably
like
not.
clear something out? Because I don't know that I do have time. And then
Well,
we
then
have a
you add the
busy.
insult of vacation, which is not an insult to you, but an insult to your workflow. And you got to squeeze even more in like a couple days before you travel. That's tough.
Yeah. Well, and we have a busy weekend ahead. So we have a soccer tournament scheduled this weekend. I'm one of the assistant coaches for the team, and we are scheduled to get like several inches of rain tomorrow.
Oh, wow.
But we're playing on turf, and so we got an email from the league that was like, "We are not canceling this tournament. Get ready to play in the rain." So it's going to be a cold, rainy day
Gross.
tomorrow for me. Yeah.
Several inches just over one day. I feel like we're turning into meteorologists a little bit. And every time we're a conversation, I was thinking of our episode with Jessing and how I was like, "What's the weather?" No, temperature. Like I want to know the temperature.
I want to know the
Well,
exact temperature.
I'm obsessing about like what I don't have here, like peeking a little neighbor, peeking over every state fence, trying to figure out which state I want to go to.
Yeah. Well,
Ah,
you don't want to
rain,
come to
forget it.
Maryland this weekend. It's going to be cold and rainy.
I feel
So,
like well, you're just getting our weather anyway. It's been like that for a couple days for us, so
yeah.
just looking forward to like the groundhog allegedly saw his shadow, so is he a liar or didn't see a shadow, right? Early spring. That's what we were
Right.
told. Punxsutawney Phil, he's a liar, is what I've determined.
Well, I
I
mean,
can't figure it out.
we've
Spring
had
did not
some
come
warm
early.
days, but
Liar.
more cold than warm lately, it feels like. But
Moral of the story is never trust a groundhog,
there you go.
you know?
Yeah.
So anyway, well, I know that I already introduced the show topic. I got a little excited, but do you have anything you want to add to the topic before we jump in, or any thoughts?
Yeah, no, I think it's a good topic. And like you said, I think that this relates not only to work as clinicians, but even in life. Like, how do because things will go wrong. That's just how life is. And so how do you handle that and overcome things like that? So as we
Sure.
talked about this topic, I was thinking about, like a work related story related to this topic. And I remember I had this patient one time, and they were like doing well, right? Like they were scheduled for a procedure the next day, and the family had been in, and all things were like a go, like they were completely stable.
Mm-hmm.
And then half an hour later, I get a call that the patient had vomited and passed away. and they were a DNR, so we didn't try to resuscitate them.
Right.
And it's like one of those things that, like, everything was fine 30 minutes earlier, and then it
Yeah.
wasn't. And then I have to call the family back in and say, hey, this is what happened. And so it's just one of those things that I think it's even a little bit harder when it's sudden like that, right? Like if it's a sick
Yes.
patient
Yes.
or a sick family member, or it's been a rough week and there's a lot of stress, like when we know things are coming, I think it gives us a little more time to prepare. But then it's also one of those things where, or, if something had gone wrong and you expected this to be the outcome, but if everything seems to be going right and then suddenly it changes, I think it's even harder to deal
You
with.
feel responsible.
Yeah.
I had something similar, interestingly, and I'm sure probably everybody listening who is practicing at the bedside. I had a patient. It was my first day back from maternity leave, and um, she was on telemetry, was going to be downgraded, and come in. I There had been some change in mentation, lots of different questions about what had occurred, but um, had her the whole day. Didn't really, you bond with some patients a little bit more, just, fine. But I really did bond with her husband. And I had my entire shift with her. And around 5 or 6, she was eating dinner. She started complaining of some indigestion and got, an order to get some additional meds. And I was doing reporting. This is when I was still working as a nurse, but I was like reporting at like 7 that night, and we went to go do bedside rounds, and she wasn't in her bed. And I turn and look, and she's like passed away on the
Oh
toilet.
my gosh.
But the hard part for me was, one, I had just sent her husband home, and I just said, I got her. She's fine. They lived about an hour, some odd minutes away. Sent him home, told him everything was fine. She was in good hands. She was fine. Never got out of bed. So that was the strange part. When I walked in the bed, I was like, or walked in the room, I was like, holy smokes, where did she go? Um, but that I almost just went blank. I just remember going, she was just okay. In the down part was, she had begged the attending at the time to take telemetry off because she had orders to move to med surg. And usually we didn't do that till they physically left the unit, but we were given
Yeah.
permission and we took it. So I don't know how long, I mean, other than the last time I'd been in there, which maybe had been 45 minutes or so. Anyway, I remember going blank. I remember coding and like trying to think of anything and everything that I could have, walking through it all, and then the dread of having to call
Oh
her
yeah.
husband. I had just said, she'll be fine.
I know. Yeah. Well, and then even too, like as we're talking about these scenarios, there's also, I think even if the outcome is positive, it's still traumatic for our teams, right? Like I think about this patient this one time I had, and she'd been in, like, come in overnight, I think, and I was like going in to see her to do an admission. And I walk in the room and she says, I just don't feel right. Like I feel a little bit dizzy. And I was like, okay. And she said, yeah, I took my blood pressure medicine this morning. I was like, all right, let me go get a blood pressure cuff, because she wasn't in a monitored room. And I walked out to get the cuff, and I came back and had to call a code. And we got her, we saved her and we got her to the ICU. And in that moment, like basically I saved her life because I happened to be in the room at the right moment. Right. But it's still so traumatic sometimes. There's still just a lot of processing you have to do, even when the outcome is good, right?
I think you're right. And we used to talk about that in the ER setting. I worked there before getting into hospital medicine, and you never know what you're going to expect coming in the door there.
Right.
And sometimes it, like you mentioned, I feel like every, at least trauma or code or, rapid that's coming in the door is traumatic, because you don't have the pieces to put together. But the one thing about it was, like, you expected it. In the ER, I expected a little chaos. I expected somebody might come in unstable. And even on the floors, and you talked about with your first scenario that it just patient was fine and suddenly
Yeah.
they weren't. And that is, I think that's the PTSD part for me. If I think about all of the negative, what in my mind negative encounters or situations, the ones that really seared in my brain were the ones that I wasn't prepared for either. It
Yeah.
wasn't the sick deconditioning patient where you're kind of begging family to say like this is the most we can do, or everybody's understood that this is kind of the end of the road. It it comes out of the blue. There's no telemetry to tell you. There's no you know, constant monitoring necessarily all the time. There, you know, continuous pulse, something that gives you some kind of indication that the patient is in some distress. Those situations are not always provided, and those are the ones for me
Yeah.
that I spend my time racking my brain at home, going through everything that I could have done differently. What did I miss? Um, what did the team miss? Where do we learn from this? But then also the fear, of one, you failed a patient. Two, you're still always in the back of your mind thinking liability. You know what?
Yeah.
I was responsible for this life. And, you know, am I going to get in trouble now? And I'm human and I can't prevent,
Right.
life
Which,
or,
for,
you
listeners who aren't healthcare providers, like, you know, something goes wrong, like there's usually a review process that we go
right.
through, and sometimes that can be stressful too, even if everything was done correctly, right? Like even if you did exactly followed, the standard of care, and you did
Hmm.
everything you could for that patient, you're still answering questions about why you made the decisions you did, and it kind of does get you a little stressed, about the liability piece of it, and
I think
and
the
you
one
know
thing we don't do well, and I don't know if it's just America, anybody listening, ex-US, let us know. I think, at least in America, we don't have, when we talked about difficult conversations in the last episode, it's what, this is great segue, right? Because sometimes we lack having those conversations and setting expectations with patients and families. So when things do happen, whether we expected them to happen or not, there is this sense that I bring my loved one to the hospital and they should save them, period.
right.
And we can't save everybody. But that feels like failure on our end, but also feels like failure on the patient's family's end. And the immediate knee jerk, they're hurting, they're grieving, is lawsuit. So you never, as a clinician, sometimes you never get away from it. You are living it for years. And I can understand how a patient's family could feel failure, but there is just like part of life is death. And that is just one thing we don't talk about a lot.
Yeah. Well, and even too, poor outcomes obviously can be viewed as failure, but sometimes too, like I think that, people come to the hospital and or even to like the doctor's office, and the expectation is that we are going to be able to give them an answer of what's going
Correct.
on, right? And
Correct.
sometimes we can't. And I even say that to my patients, like from the beginning. Like I'll tell them as I'm admitting them from the ER, like these are all of the things that I'm going to do to rule out this list of things. But I might not be able to tell you exactly what this is. I can tell you it's not something life threatening that I need to keep you in
Hmm.
the hospital for, but you may leave here without an exact answer. And as a clinician too, that's frustrating sometimes to not be able to tell them, right? And it
Right.
feels a little bit like failure too in that regard.
Yeah, that's a tough one. I feel like if you, even in the outpatient setting, and again, listeners in that setting, let me know. I still even feel like if forget that, scrap the outpatient setting. Let's just say you're walking in the grocery store, you're going to Meijer, you're going to Kroger, and you drop dead.
Right.
Nobody's suing Kroger and Meijer for not being able to recognize that you weren't well. I think again, like sometimes bad things happen and they have nothing to do with what you came to the hospital for,
Right.
or the doctor's office for. But there is this expectation that, of course, for what we do, that, you're in a setting that these tragedies in patients' families' minds should not happen, or we should have, this magic ball that can see foresee the future and predict. And there is a lot that we do now to maybe get ahead of some of these things. At least we've seen like the evolution of sepsis protocols and escalation of sepsis, like notifications and
Right.
alerts or however they do them for each hospital. Even just mark labs and the escalation of those things. And
Yeah, the protocols that we have in place. Yeah,
yeah, but you don't always know,
I know.
nor
No,
can you
we can't, well,
prevent it,
yeah. Well, and
you
we
know.
can't predict it a lot of times either, right? So we don't have a crystal ball where we can predict it. But
I will tell you
um,
that in one of my cases, the one that the very first one I shared, I would go home. That night was the longest night, probably one of the longest nights of my life. And I'll just add, I was postpartum about 9, 10 weeks. Um, it just wrecked me. I would close my eyes and see her face. I started having
uh,
panic attacks. There were a lot of things that case changed me as a clinician. And I remember eventually saying like I need to utilize our mental health services for work and start talking through because I believed that I was supposed to experience death. And I believe that in this profession, I should be a little bit Teflon to it. But that case, I think because I think we mentioned it a couple episodes ago, like I need a controlled setting. I can never do this, your vet thing in the van.
right.
Um, because that's part of it. There's something about I was in a controlled setting. It felt like, oh, something happened. I knew what to do. But yeah, I beat myself up. I went into a pretty significant depression. Took more time off of work. Like I mentioned, it was my first day back. I took an additional couple of weeks. I thought maybe I'd come back too soon and I'd missed it. I mean, a lot of just self shame and guilt, but ended up in talking with a counselor and dealing with the PTSD of it, which was really hard to reconcile. But I know that we probably all have our stories, and you've got yours. I'm curious, therapy's not always an option for everybody up front, but I don't know ways that like after your first patient, what were some ways that you managed through that stress of
Yeah.
what occurred with that patient?
I think it was more for me, like I leaned on my team, right? Like I worked with a team that um we had a really good open communication, and we're really friends in addition to being colleagues. And this is the team I worked with right out of school, trained me to be, a PA and helped me grow. And like I remember one time I had a patient, and I guess this was probably my first one in the hospital. And it had been a patient that was on our service for days and had declined overnight and passed overnight. So when I came in the next morning, I found out, right? And I immediately called my attending and I was like, "Oh my gosh, like this happened." And we like immediately found each other in the hospital and just sort of debriefed about the whole case and
Mm,
went through like all of the results and all the labs and all the notes and everything that we did and really just like talked through it. And they were really there for me in that moment and just kind of bounced, like were there to answer my questions. And that's the first family member I had to call. And oddly enough, it made me feel better. Like, not
mm,
better, I guess is not really the right word, but it made me feel a little bit comforted to be able to talk to the spouse, right? Like I called the spouse because it was one that I had seen, for several days in a row as I was caring for the patient. And it made me feel better sort of just to talk to them and like hear that they were like, okay, right? That they
right,
were, that they had had time to process it from overnight and then, to give them the space to ask the questions that they needed to ask and to feel like I could still be there for them in that moment. It made
right,
me feel better. So I think it was the combination of having my team to lean on, but then also having that relationship with that, the spouse to be able to call them and just say, I'm so sorry and be able to have a conversation with them.
right.
I think it kind of brings closure to it a little bit, actually.
Sure. And I think you also have to be prepared for grief
Yeah.
because they're not always going to go, oh, don't worry about it. It wasn't a really big deal, April. You did the best you could and, pat you on your back and send you on your way. They're not all families are going to react like that. But I do agree, like that patient, the very first one I mentioned, coming eye to eye with her husband, I was terrified, terrified. Now, I didn't have to break down exactly what had happened. I had no idea. I wasn't the attending. But I had to look at him and talk about what I remembered for those last, few hours or hour or so that he had been gone, and he wasn't happy. And I believe I took his grief as anger towards me and just really like beat myself up a lot more. But I think it could have been more harmful in the long run had I never faced him.
Yeah.
Not that I feel responsible, but just I felt guilt. This man lost his wife. And I had just said she'll be fine. So I would agree, but I would level set the playing field to say that not all families are going to be
No, yeah.
happy or loving and opening and hug you and tell you thanks for all the work you did. Those usually happen in our our hospice cases or our,
Right.
withdrawal of care where they have time to prepare. But don't be surprised to anybody going through that. Don't be surprised if they are upset with you. But I do believe in that grief. Like as you heal through grief, they can, place their anger, sadness, whatever in the right place. The best thing you can do is talk to them,
Yeah.
not avoid. It just leaves so many, I think it just leaves a lot of opportunity for things to be rewritten that you have an opportunity as a clinician to clear up versus
Yeah.
leaving a bunch of questions, if that makes sense.
No, I mean, that definitely makes sense. Yeah, being able to, answer questions if they have them. And I mean, as clinicians, we want to help people and we want to support people, right? And so even if they're mad or they're angry or whatever, you're still sort of helping them, giving them that avenue to vent if that's what they need to do, or, ask questions if that's what they need to do. And I do think it's important for both people.
Hmm. I think another thing that is important is actually something you've already brought up, which debriefing
Yeah.
and unloading. We you see this a lot in ER settings, following some trauma. The whole team will debrief, and just because you do it every day doesn't mean it doesn't like sit in your psyche and start um, building up. And I worry more that if we don't debrief every code, whether or rapid even for that matter, we should always have a review period with the team. And obviously, the more traumatic or um, challenging the code or intervention is, can determine how soon you need to do that. But I remember during COVID, we had a new Christmas Eve, 16 deaths
Oh
during
my gosh.
our one shift. And our patients were on med surge floors, and they were med surge nurses who were really given these, bi-level intubated patient, like just all kinds of patients that they had limited experience with. They were stressed, but 16, I remember.
That's a lot.
And no patient families were allowed in yet. And so it was a lot of iPhoning and iPadding and, trying to do that. But I remember that day in particular saying it was Christmas Eve. You're trying to have this holiday spirit, but these nurses needed outlets. One of them was in the clean room, like in a corner, sobbing behind the Pyxis because she had never terminally extubated a patient before. And it was just a lot for her. The families, everybody else knew it was going, but it was still a lot. And I thought, we're not talking to this team. These people are not processing. Now, COVID was, a different beast, but any situation like that, I think you need the space to process, and you need the space to allow your teams to speak up, speak out. What scared them? What went well? What didn't go well? What's on your mind? What are you feeling? We're human, but my biggest fear is we become machines if we don't start talking
Oh
about
yeah.
these things, and then we become numb.
Right, because
to
then you
these,
cope. If you can't talk about it, then you cope by pushing it down, right? Like you cope by
right?
just by pushing it away and saying, I'll deal with that later. And then something else happens and you'll deal with that later. And before you know it, you've pushed all of your emotions away and you're just going through the motions of life, right? And you're
Yep,
in your day and not really processing any of it. And
right.
it'll catch up with you eventually.
Yeah, or you use like unhealthy coping mechanisms
Right.
to start shoving it down, shoving it down. So, yeah, kind of morbid talk. I know we're like a little more lively, but I think it's a necessary, very necessary subject.
It is. It is.
Yeah. What are other ideas you have for, or even recommendations for managing stress when these type of things happen?
Yeah, I think that, in addition to the debriefing and all of that, I think it's just sort of how you manage stress normally, right? Like how, even if it's outside of work and when things are happening at home or whatever it is and you have stress, just you still have to engage in self-care, right? Like you have to balance like it kind of goes back to like that lovely work-life balance word
I
that you
know
love.
we did a great, I know we did a great like work up to this episode, didn't we? Like
We
all these things to
did. We didn't
reference.
even
Yeah.
realize that when we did it that we were like setting ourselves up for this conversation, but
Kind of a big deal, but
yeah.
I'm just kidding.
But yeah, I mean kind of maintaining your balance, like, and not letting the stress kind of overcome you and still engaging in things in your personal life and, spending time with your family, working out, however you relieve your stress normally, making sure that you use your support systems, right? Like we all have
Right.
hopefully we all have teams at work that get it and are there with us and support us, but our friends and family are there too, and they may not fully understand exactly what's going on, and we may not be able to fully tell them all the details, but like if you walk in the door and had a bad day, then sometimes even just a hug from your spouse or your family member can go a long
Sure.
way, and they can just say, I'm here, if you need me, or do you need me to get you a dinner, or, whatever it
Hmm.
is that, they can do for you, because a lot of times we can't bring it home. We can't talk about it at home. And they even if we did, it might not necessarily make sense, right? But,
Yeah, that almost makes you a little more frustrated where you're like, no, okay. Then you have to like go back and explain all the medical terms first. Like,
right,
and that's
right,
not even necessarily, I'm not making light of a death, but I'll just say like just even, regular work stuff where you're like, oh, da 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 da. And they're like, well, what's that mean? Okay, so that
right.
means blah, blah, blah. And so then I did, well, what do you do? How do you do that? And you're like, never mind. Never
Yeah, and
mind.
then it's like, "Why didn't you do this?" And I'm like, I just wanna vent,"
I just had a
like,
good
I
day.
just
That's all
wanna
I was just gonna say. It's
yeah.
fine. It was fine. Everything was fine. Nothing to
Which I
see here.
think is what we need our team for, right? Like our
You need
team that we
somebody that
work with.
understands. Okay, yeah,
Yeah, and
absolutely.
your work friends. Like, I remember there was a day, during COVID, and it was just a rough day, and at the end of the day, we were all there was, like, I think 4 of my teammates. We were all in the office, and we were documenting, and we had, like, a lunch that day, so we were getting out the leftovers we are gonna eat. And somebody, one of us said something like really dumb. I can't even remember what it was, but I just remember that the 4 of us just like busted out laughing and were like hysterically laughing. And it was like the best medicine, right? Just
Right.
like at the end of the day, after a really long day, be able to just sit around and laugh and have fun with the team for 5 minutes and forget what we were dealing with. So,
Yeah. And you mentioned the like the support systems and the work life integration. I would add to the work life part, if you are working more than you are contracted and you are experiencing significant levels of stress following poor outcomes or unexpected outcomes, I would encourage everyone to dial back on work a
yes.
little bit because it's not gonna. We all have bills to pay, um, but I think your mental health is more important, and you do have to step away from the environment. You have
Yeah.
to. So if you are experiencing these things and maybe the stress is getting even greater, you're reacting a bit more. Again, this great example was COVID. We weren't we really weren't conditioned to experience in the areas that we did the volume of death that we were, and those were the times especially where you'd say like you don't pick up extra
Right.
right now. I know we all want to help the teams, but do it in moderation. Give yourself some breaks. Long stretches, you tend to get you even more just physically worn down, but emotionally worn down as well, puts you at higher risk for mistakes. But
Yeah.
just even coping through those longer stretches is can be very challenging and make it even harder for some, reasonable discernment in your next cases or your next day of work.
Right. No, I agree. I mean, I think our inclination, like I said earlier, we want to help. That's our nature. And so the inclination is just to say yes, like we are asked to pick up a shift because we're short staffed. And the answer is always yes, right? Because
Right.
we're supposed to help our team, but sometimes it shouldn't be yes, probably, right? Sometimes the answer should be, I need a day, to get myself refreshed and rejuvenated, and then I'll be back tomorrow to help out.
Yeah.
So
Yeah. Absolutely. What other ideas do you have or thoughts regarding managing stress or just maybe recommendations, advice, anything moving forward before we wrap this up?
yeah, I think that, really as I think about this, over the years in developing as a clinician, I think at the end of the day, what has always helped me is to know that I always did the best that I could for my patients in the moments with the information that I had. And I was always
Mhm.
there, when my team needed me or my patients needed me. And I think that if you, maintain that, if you maintain, following the standard of care and doing all that you can for your patients and advocating for them when you need to, then, even when bad things happen, I think that you can fall back on that and know, like, I did the best that I could and I
Right.
gave it, every shot that I could to make things better for them. And I think that applies to not only work, but just, everything, right? Like if you put in I tell my daughter, like in soccer, you may have lost the game, but as long as you played your hardest and you did your best,
Right.
that's all, then you should feel good about that. And so, not that we, should feel good about bad outcomes, but I think that it's just, as long as, at the end of the day, as long as you've done everything you could,
Right.
um, I think that's just what you have to rely on.
And I think that lends to um, one piece that we don't think about a lot because we're immediately like not want to. We don't want to talk about peer review. We don't want to talk about any case review. But it is important to participate.
It
One,
is.
it does not. You don't look guilty. We make mistakes, and or sometimes it's not a mistake. It just was
Yeah,
life.
sometimes you did everything right and it just, life happened and that's what happened.
Correct. And it doesn't, even if you did, or, missed some, there's a lot of things, and we've all been there. None of us have practiced perfectly our entire careers. I just think participating in that process is so important. Once you're, level set, you also learn a ton
Yes.
being a part of that. One, you get to have an opportunity to kind of state your case and your position, but beyond that, you learn immersing yourself in that process. What misses occurred along the way that you didn't even know about, or were there misses? There might not have been. I don't want to assume this is all like when healthcare fails. This is just when things don't go the way we want them or expect them to go. But let's say there is some, failure, whether that be communication, practice, etc. The peer review process just gives you like a great visibility into what was missed along the way and does help improve your practice if you're a part of it. And I also think it's just really good for every clinician to face versus run from because it's an opportunity for you to speak your piece.
Oh yeah, I mean it's we, being involved in the peer review process here at Sound for a while. I mean it's a good opportunity to develop new protocols or new, ways of doing things like, and then that can benefit other people, right? Like, so if the team participates in the peer review and we say, okay, like, to prevent this in the future, let's change our system and do it this way, then hopefully that prevents errors from happening in the first place. But also it's a chance to get another set of eyes on a case and give you a
Right.
very objective opinion, right? Because we're not, it's coming from somebody who was not involved in the case, so there's no bias, right? And I
Right.
remember we had an APP who called me and just said, I just need I've been thinking about this case over and over in my head and I just need somebody else to look at it and tell me like am I thinking along the right lines or should, something else have been done? And I said, well, just submit the case and we'll take a look at it. And I think that gave them just a sense of relief to know, okay, somebody else is going to take a look at it and let me know and answer my questions, right? Because part of it is like that just kills you is just the unknown, right? And the mulling over it in your head forever. And so
Right.
engaging in the process and being receptive to that feedback and being open to answering those questions and having those discussions is really important for a lot of reasons.
Totally agree. I do. Again, this is definitely another topic that I'm thinking we could even expand on further because there's so many, parts of this to break down, but we'll kind of maybe see where listeners weigh in and would, absolutely love to hear some feedback on this one or maybe even some, further ideas. So anybody listening, please, let us know. We'd love to talk about this further.
Yes, if you guys have any comments or suggestions for us for even additional topics that you would like to hear about, you can reach out to us at our email, which is oncallpodcast@soundphysicians.com. You can also reach out to us on Instagram at On Call with April and Alicia.
That's right. And until next time, everybody, you stay well and we'll stay on call.
Bye, everyone.